Welcome to Wellness by Mommy. I hope you are safe and sound. In today's video, let's talk about how certain factors causes infertility. Watch till the end to understand some factors that are within your control. Some factors that may reduce your fertility are within your control. For example, smoking reduces fertility in men and women, so quitting is advised, for this and of course, many other reasons. Other causes for reduced fertility are not within your control, for example, age-related fertility decline. Age. Female fertility peaks from the early to mid-20s, and after age 35, it starts to rapidly decline. Male fertility also declines with age, though not as dramatically. While some men are still fertile after age 50, women with uteruses are completely infertile after menopause. Chronic diseases. Even if a disease is not directly related to the reproductive system, it can still impact fertility. Several chronic diseases, along with their treatments, can lead to fertility problems in people of any sex, including diabetes, hypothyroidism, periodontal disease, untreated celiac disease, hormonal imbalances or diseases of the reproductive system. Hormonal imbalances can reduce fertility or even cause infertility. For example, endometriosis, polycystic ovary syndrome, and premature ovarian failure, also known as primary ovarian insufficiency, can lead to female infertility. Low testosterone can lead to male infertility. Male infertility, either alone or together with female infertility, is the cause for why a couple can't get pregnant at least 40% of the time. Infection of the reproductive tract. Reproductive tract infections can result in infertility. The most common cause of these infections is sexually transmitted diseases, STDs. This can cause pelvic inflammatory disease, PID, in the female reproductive system. Men can also become infertile after contracting an STD. However, not all reproductive tract infections are caused by STDs. For example, some medical procedures can cause an infection. Medication side effects. Some medications may reduce fertility, including allergy medications, which may dry up cervical mucus, antidepressants, which may cause fertility problems for men, certain types of cancer treatment, radiation therapy near reproductive organs. Obesity. Obesity is one of the leading causes of preventable infertility. Even being slightly overweight can reduce female fertility. Obesity can cause ovulation problems and may reduce sperm health. Reproductive tract blockages or abnormalities. Problems with the ovaries, fallopian tubes, or uterus can cause fertility problems. Issues with the testes, vas deferens, prostate gland, or seminal vesicles can cause male infertility. Blockages or abnormalities may be present from birth, congenital abnormalities, the result of an injury or medical procedures, or occur after a disease or infection. Most commonly, blockages are caused by adhesions, scar tissue. Many people are unaware that they have these conditions. They may cause no symptoms and go undetected during routine medical visits. But specialized fertility testing can uncover them. Unhealthy lifestyle habits. Smoking, excessive drinking, and recreational drugs can reduce fertility for people of all genders. Less dramatically, more common unhealthy lifestyle habits like not getting enough sleep, too much stress, and eating an unhealthy diet may slightly reduce fertility. Unexplained infertility. About 1 in 4 couples never find out why they can't conceive. This is known as unexplained infertility. I hope you find this helpful. Please subscribe for more interesting, evidence-based, educative and informative videos. Like and share this video. Turn on your notification icon so you can be notified when next I drop a new video. I desire for you good health and long life. See you in my next video. Till then, stay safe and remain healthy. Peace.